Hi everyone, I'm Sarah. Today we're going to go over a newborn assessment, reflexes that are associated with newborns, as well as APGAR scoring. So let's get started. Okay, so we're going to go ahead and start off with a newborn assessment. First off, we're going to look at the general appearance of the baby. What does the baby look like? How are they acting? How are they responding? Things like that. We're going to do a set of vital signs. Temperature is going to be axillary between 97.7 and 98.6 degrees is normal. Higher or lower could indicate possible infection. You want to make sure that you check the baby's temperature after its first bath because they do not have the ability to shiver and therefore they could get cold easily. So you want to make sure you check after their bath. Apical pulse is the way we're going to get their heart rate. You want to listen for a full minute. It should be between 110 to 160 beats per minute. Respirations, you want to count again for a full minute. It should be between 30 and 60 breaths per minute. You want to make sure that there's no sign of labored breathing, respiratory distress, anything like that. Next, blood pressure. We normally don't take blood pressures on newborns. If for some reason the doctor asks for it, you want to make sure you check the lower with the upper bilaterally, compare. Any issues with the comparison, any differences could indicate a problem such as coarction of the aorta, which would require immediate attention. We're next going to get their height and weight. So for weight, you're going to put them on the scale, naked, no clothes, no diaper, nothing. So we're going to place them on the scale after it's zeroed out, of course. Place them on the scale. You want to make sure that you leave your hand above the baby to prevent any falling, but do not touch because obviously it'll throw off the weight. For a height, you want to make sure you get from the crown of the head all the way down to the feet with the knees and hips straightened out. Some nurses find it easier if you place the baby on the exam table, put a mark at the top of the crown with a pencil, straighten out the knee and the hips and everything, and then put a mark where the feet are, move the baby, and then measure that afterwards. You want to make sure you get a head circumference, chest circumference, and an abdominal circumference as well. Next on our assessment, we want to take a look at the skin. You want to look at the color. Is it blue? Is it pink? Is it yellow? Yellow could indicate jaundice and need for phototherapy. So skin color is very important. You want to make sure to look for any birthmarks, Mongolian spots, which are normal. They usually are located on the lower back buttock area, and it looks kind of like a bruise, but it's a Mongolian spot. Stork bites are another normal finding. It's just a capillary malformation, and it could happen along the nape of the neck, on the eyelids, or between the eyebrows, and that should go away with time. The eyes, you want to look to make sure that they are symmetrical. The eyelids are symmetrical. You want to open up the eye and make sure that the pupils are reactive. That the sclera is white. You want to make sure that the conjunctiva is moist and pink, and that everything's round and in a good position. We're next going to move to the ears. You want to check the placement, making sure that they're even with the eyes. Low setting ears could mean a possible genetic chromosomal malformation such as Down syndrome, so you want to make sure you check that evenly, make sure that they're symmetric, that they're patent, things like that. We're then going to go to the nose and the mouth. Again, make sure that the nose is symmetrical and patent. You want to make sure that the mouth is open up the mouth, check the tongue for placement, check symmetry, look at the lips, make sure they're nice and pink. Look at the gums, again, make sure that they're pink, and things like that. Next off, we're going to move to the head of the baby. We want to make sure that it's symmetrical. Fontanelles. The baby will have two fontanelles, the posterior and the anterior. Posterior usually is open until about 3 months of age. It is sometimes closed at birth, so that's not an issue. The anterior fontanelle, though, will be palpable between 9 and 18 months of age. You want to make sure that it's nice and soft, that it's not bulging or sunken. Bulging could indicate a sign of increased intracranial pressure, which is not good. And sunken could be a sign of dehydration. You also want to make sure that you take your fingers and you run them across the cranial sutures to make sure that there's no problems there. You want to make sure that the facial appearance is symmetrical. You want to check the range of motion of the neck, rotating the head left to right, making sure the head can tilt. So you want to take the ear, touch it to the shoulder on both sides. Limited range of motion could mean possible meningeal inflammation, so that could be a problem. Another thing with little newborns is a head lag. So when you were to pick them up, the head would stay back, lagging, so that's why you want to make sure you support the head and the neck. That usually lasts till about 4 months of age. So when you pick up the baby, the head goes with it, such like this. If the head lag lasts longer than 4 months, that could mean a possible developmental delay, so you want to get that checked out immediately. You're also going to take a look at the neck, make sure that there's no signs of bulging. You want to make sure you look at the trachea, make sure it's nice, symmetrical, straight, things like that, that there's no problems. Then we're moving to the chest and the lungs. You want to make sure you listen to the lungs, make sure they're nice and clear. You want to check the breathing motion of the baby, make sure that symmetrical chest rise, that there's no bulging, no signs of respiratory distress, that the baby has good color, which would mean good oxygenation. The heart, again, you're going to take a listen to. You want to hear S1, S2. You want to inspect and palpate for any like I said before, any neck bulging or vessels. Pulses, we're going to check the brachial pulse up in the upper arm, and the femoral pulses. That's where you get the pulses in newborns. For the chest, back to the chest, you want to make sure that you look at the nipples. You want to make sure that there's 2 of them, that there's no extra ones, which is possible. Some breast enlargement and some clear fluid draining is normal due to mother's hormones, so that is a normal finding, but you want to make sure that they're symmetrical, midline, things like that. The abdominal assessment, you want to take a look at, make sure that the stomach is a little round, protrudes slightly, but that it's nice and soft. You want to take a listen to bowel sounds. There should be bowel sounds in all 4 quadrants. That there's no discharge, no scarring, no deformities, nothing like that. We're then going to move to the musculoskeletal, which obviously you want to know throughout your entire exam. You want to see how the baby's reacting and moving. You want to make sure that you look at the shape and appearance of the hands, the palms, the feet. You want to make sure that, you can wiggle their toes. Orontes maneuver is when you put the baby down supine on the exam table. You put the legs together. You flex at a 90-degree angle. And you move out, and you want to see if there's any clicking noise. If there's clicking, it could be a sign of hip dysplasia. Barlow's maneuver is when you're going to maintain the 90-degree angle and you're going to push down, adducting the hips, and you want to make sure that the hips stay in place. Neuro assessment, we're going to, again, assess throughout the entire exam, make sure the baby is acting appropriately, that there's no sign of developmental delay, anything like that. Genitalia, female, you want to make sure that you can visualize the vagina. It is a common finding for there to be enlarged labia or clitoris and a little bit of blood. That again is due to normal mother's hormones. So that again is a normal finding, but only should last for a couple weeks after birth. For males, you want to check you know, the penis and the scrotum. You want to make sure that you look and make sure that the urethral opening is in the correct spot. You want to make sure that both testes have descended. And for both female and males, you want to make sure that there's no odors or drainage coming from the genitalia. The first reflex we're going to talk about is called the rooting reflex. What you're going to do is you're going to take one of your fingers and you're going to stroke one of the newborn's cheeks. The newborn should then turn their head toward the cheek that is being stroked and open their mouth. This reflex usually lasts 3 to 4 months. The next reflex is called the sucking reflex. You're going to take a gloved finger and put it inside the newborn's mouth, and they should begin to suck on your finger vigorously. This normally lasts throughout the entire infancy. The next reflex is called the tonic neck reflex. What you're going to do is you're going to lay the baby supine, and you're going to turn its neck from side to side. The side that you are turning the baby's neck, the arms and legs should extend. It should happen the opposite way on the other side. This is strongest at 2 months and usually lasts up to 6 months of age. The next reflex is the Moro reflex. This occurs when the baby is startled or feels like they're falling. You're either going to make a loud noise to startle the baby, which also will test their hearing if you make a loud noise, or you're going to hold the baby in a sitting position, making sure to support their head or neck, and you're slowly going to let them drop back a couple inches to make it feel as if they're falling, like so. The arms and legs should extend outward, and their hand should form a C. This reflex is normally lasting 4 to 6 months. The next reflex is called the Babinski reflex. You're going to take one of your baby's foot and you're going to stroke the bottom from going bottom to top of the foot. The great toe should extend upwards and the other toes should extend outwards. This usually lasts until the baby starts walking well. The next reflex is called the stepping reflex. You're going to hold your baby up on the exam table with their feet touching the exam table, making sure to support the baby. And when you put their feet down on the exam table, their legs should extend in a walking pattern. This normally lasts about 4 to 8 weeks of life as well. Next reflex is the Palmar grasp. You're going to take your baby's hand and put your finger in the palm of their hand, and the baby should grasp your finger. It's strongest at ages 1 to 2 months. The next reflex is called the Gallant's reflex. What you're going to do is you're going to take your baby, making sure to support the head and neck, and you're going to hold it on its belly. You're then going to stroke its back on the side, and the baby's trunk and hips should extend toward the side that's being stroked. You would then again do it with the other side. This reflex normally lasts about 4 to 8 weeks of life. Persistence of any of these reflexes past the recommended date range that I gave you could be signs of a neurological disorder, and the baby should be seen by their pediatrician as soon as possible. The APGAR scoring system is used to evaluate the baby's health at 1 minute and 5 minutes of life after birth. The scoring goes between 0 and 10, with 8 to 10 being the baby's in very good condition, maybe just a little bit of suctioning, and less than 8 would be a scoring that would require more intervention completed by the physicians and the nurses. It evaluates the baby's respiratory effort, heart rate, color, muscle tone, and reflex irritability. A score of 0 in each category would be things such as blue, cyanotic skin, or pale skin all over, absent heart rate, absent cry, flaccid muscle tone, things like that. That would all be considered a 0, which is not good. A scoring of 1 in each category would be blue cyanotic arms or legs, but a pink body, a weak cry, less than 100 heart rate, weak muscle tone and reflexes, and a scoring of 2 in each category would be a very strong cry, greater than 100 heart rate, good reflexes, and a pink all over body, meaning a healthy baby. And that's what we want, a healthy baby.